Here is a 60 years male with long segment anterior urethral stricture buccal mucosal graft has been planned. By perineal approach, skin subcutaneous tissue being incised, bulbous sponjosus laid open, and corpus sponjosa along with the urethra has been dissected in the anterolateral aspect. So the one side urethral mobilization being done from the bulbar urethra up to the proximal aspect of the penile urethra. Prior to the opening, cystoscopy was done and thermo guide wire was placed. Here you can see the sponjosa with the urethra and covered by the bulbosponjosus muscle. The dissection from bulbar urethra to the penile urethra has been done. This picture you can see the corpus bulbosponjosus splitted, and underneath is the corpus sponjosum along with the urethra. So prior introduction of the thermo helps to identify the urethra, the buccal mucosal graft being taken, the right side buccal mucosal graft being taken, and the wide tissue, thin tissue of buccal mucosal graft which has a panlaminar blood flow, which is advantageous in uptake of graft. The graft is being thinned out by removing the subcutaneous tissues, and it is longitudinally cut. The urethra being opened up to the place of the pinkish, the normal urethral appearance, and the graft being placed, the two longitudinal being cut graft has been placed one below. The graft has been stabilized posteriorly and fixed with a 4-0 monocryl, and one side of the graft is sutured with the cut end of the urethra, and the other side being sutured with the other cut end of the urethra with the 16 to 18 French silicone Foley in place. The pink appearance of urethral mucosa is very important to prevent the gray mucosa and the recurrence because of the gray mucosa due to the existing spongiofibrosis. So this identification helps to prevent the recurrence. So as much as possible, the normal appearance of the pink appearance of the urethral mucosa should be identified, and the graft is placed the longitudinally up to the part of normally appearing mucosa. With the silicone catheter, the graft has been closed on the other end of the urethra. The one side mobilization prevents excessive mobilization of the urethra, and the one side vascularity is also being preserved. With the drain, single drain, the patient 16 French suction drain was kept, and patient